Hi, everybody. Thanks for being here at the last panel. We're so excited, and I just want to really thank all of you for hanging in there and keeping up the enthusiasm and engagement. Really excited to introduce this next panel and for you all to hear the voices of some local nonprofits. So I'm going to start with Kate from Teton Behavioral Health Alliance. So Kate, if you want to introduce yourself and talk about the work that you're involved in.
Sure thing. Thank you so much. It's an honor to share this stage not only with local experts, but with the national experts that have come to our small town. So thank you so much for being here. My name is Kate Schelbe. I am the backbone leader of the Teton Behavioral Health Alliance, which is an initiative of the Community Foundation of Jackson Hole. We began about 2 years ago, well, I began in my role about 2 years ago, and that the mission of the Alliance is really around addressing the behavioral healthcare system using the collective impact model to think about prevention, treatment, and crisis response, and really looking at how to address the gaps and inequities that exist to benefit all who live and work in Teton County, Wyoming. Our purpose is to convene, to coordinate, and to facilitate. So it's really important for us to identify the fact that we are not providing direct service. We have partners who provide direct service. We're really trying to think about this as a system-wide change and how to influence things at a higher level so that the organizations that are direct service providers can meet the needs of our community. Our community partners are deeply involved in this work. The Teton Behavioral Health Alliance is comprised of over 20 organizations. Many of those organizations have had representatives here today. We could not do this work without them, and we're so thankful for their participation. We've talked a lot today about the national landscape of behavioral health. You folks are experts in this, you know this data. I want to zone in a little bit more to think about what the unique needs in mountain communities are. We've heard a little bit about this already today, but to reinforce, we know that the social determinants of health are alive and strong in Intermountain West. So thinking about the cost of living, housing insecurity, childcare, moving on to what that means for geographic isolation, how that impacts seasonality when we have road closures, some of which are predicted, some of which are natural disasters, the cowboy up mentality of stigma and how that can play out in a small community. Also the reality of it being a small community when you go to a local provider, chances are that someone in that office is your neighbor, goes to a similar organization that you go to. And so thinking about how to combat that stigma in a small town. And we also have this unique challenge of culturally responsive care. In the Intermountain West, in resort communities, we're seeing a larger increase of immigrant populations, which is something that this panel is going to talk about more. And so making sure that we have the providers are equipped to provide both the linguistic and culturally responsive care that the community members need. The work that the Teton Behavioral Health Alliance does is really driven by the values and guiding principles that you see in front of you. I want to zone in and highlight one specific aspect of that, and that is data and evidence, that we are guided by the numbers and the stories from our community. And we have done a lot of work to secure data and stories to help us make informed choices. We have partnered with the Cats Amsterdam Foundation, who is leading an incredible work in the Intermountain West and resort communities to address behavioral health needs. And so there's a group of, I think, 8 organizations or 8 communities in the Intermountain West that conducted a survey this January and February, one assessing the community needs perspectives of behavioral health needs and one assessing providers' experience. All of that data is available on a public dashboard for this shared measurement framework. So we can go in and compare how our data in Jackson compares to places like Telluride, compares to places like Park City or Tahoe Truckee that have similar demographics and similar challenges and opportunities that we face. using that data has been incredibly helpful for us, and it's allowed us to strengthen our own local data set. So the Community Foundation of Jackson Hole has partnered with Legacy Works to create an overall community well-being framework dashboard. So the idea is that this dashboard is based in various different sectors. It is using data that is collected from community organizations, and that we want this data to be used for the people and by the people. We'll talk a little bit more about that with Alin and how her work with Voices has supported this as well. I just took a small screenshot of this so you can see the data's interactive dashboard that you can play around with. You can see the information by different demographics, so thinking about our Hispanic and BIPOC communities and the barriers to care that they experience as reported in our survey. Obviously, cost is the largest one. And so now we as a community can use this information to inform our next steps. All of this information is analyzed in an incredible report created by Third Horizon Strategy in partnership with the Community Foundation and Teton Behavioral Health Alliance. And they provided us with some pretty incredible recommendations. Many of us were like, yep, we know that's the work that we have to do, but it's nice to have that external validation that, yes, we're on the right course. The main piece of that is focusing on behavioral health equity. And so for me, one of the pieces that I really love about my job is how it aligns my personal values align with the values of the organization that I'm serving, and the importance of addressing the gaps and inequities that exist. So thinking about how we can improve behavioral health equity in our tiny community, and also recognizing, as someone said this a little bit earlier with a share out, the importance of highlighting the things that are already happening, and that our partners are well at work doing this work, following best practices, expanding learning opportunities, and continuing to address the needs in our community. I'm so honored to share this stage with my colleagues, and really a lot of the work that we do is deeply supported and possible because of Alin and the work that she does with Voices JH. So I'm excited to pass the clicker over to her. Thank you so much.
Thank you. Thanks, Kate.
Hi, everyone. I'm also really grateful to be here. As Kate said, a lot of us work together in the mission of just making this community a place where everybody can thrive. And I'm really honored just to be able to be in this space with you and share about the work that Voices JH does. At the core of our work, we are on a mission to build belonging. And I want to let that sit in. We are in a mission to build belonging. And as Kay shared a little bit, one of our backbone community members here in the region, and what makes this region lively and is one of the most backbone leaders, is our immigrant population. A lot of people do think that our immigrant population is Hispanic, which the majority are, but we have an increased population from Eastern Europe and Asia. And I want to provide this highlight right here with 50% of the Latino students in the school district. Because that's half of the students in the school district are Latina. I'm just gonna let those two facts sit in, because what we are in a mission to do in building belonging and how we build belonging is that we believe that we, with belonging, I'm so excited you get to see me present when I get really nervous and my accent thickens. By building belonging, we believe that if we increase the social cohesion of families, if we unite our community, we increase the social capital of our immigrant backbone community. And social capital is increased by the way we work internally. We are 100% immigrant-led. That is that's not very common in general, and I just want to let that also sink in, that we are 100% immigrant-led. That means our entire staff, contractors, and our entire team is immigrant-led. And that is one of the ways we're increasing social capital. But we're also increasing social capital by the people that we serve. Our mission is to empower and engage the immigrant population and in the Teton region and its surrounding areas. We really believe that we can create a Teton County where immigrants are at the center. We do this through the clients that we serve, which are immigrants, through 3 different programs. Each program is very unique. The first program is outreach. And if you can think of how that looks like, that would be a little bit more of Voices being a bridge. If you can picture Voices as a bridge, we are the bridge. Our outreach service ensures that our immigrant populations are aware of local resources, information, and opportunities. We partner with community partners, such as the Community Foundation and 30 Plus, where they work with us to share culturally competent information through one-on-one model. That means we have what are called mobilizers that have a network of other immigrants, and they are sharing information through text message, through WhatsApp, very individualized. We have individuals in our community who don't know how to read and write, so we give them a call. That is the information being sent over and ensuring our immigrant population is informed. If you continue to think of that bridge, Voices, our inclusion service, brings voices back from community immigrants through research back to our greater community. We provide focus groups and surveys in English and Spanish, depending on the immigrants that we're working with, to ensure that our community partners have immigrant voices represented at the center of their work. Our third service, if you can think of Voices as the bridge, is we're making the bridge bigger. We are empowering our immigrant communities, ensuring that they have the professional and personal skill sets to build and develop and achieve their personal vision of success. And in other words, we are creating the workforce development and increasing the workforce development, ensuring that they are also thriving. I'm just gonna let that metaphor of the bridge sink in. So outreach sends information to community partners, or from community partners to immigrant families. Inclusion, information from immigrant families back to community partners. Empowerment, we're making that bridge bigger. So by the one time, the bridge is no longer gonna be a bridge, it's gonna be an extension of the community. Our network, so what do I mean when I say our network? We've worked with over 600 immigrant households. And those families come from 24 different countries who speak over 18 different languages. 24 countries, 18 different languages. We partner with over 30 nonprofits, the center being one of them, Community Foundation being a newly one of them. 30 different nonprofits. That is, if you don't know, Teton County has over 200 nonprofits. That's 30. We have a long way to go, but we'll get there. And that is the work that we do. I just want to share the quick value that we bring is that we do everything bilingual. So everything is in English and or Spanish. We have staff who don't know how to speak Spanish, but they only speak English. And we have staff who only speak English, but not Spanish. So everything that we do is bilingual. We're immigrant-centered. We're for immigrants, by immigrants. I'm just going to briefly share about myself, and I'd like to share that I'm like the first guinea pig of how we've made Voices. I grew up in Voices. I grew up here in Teton County. My mom brought me here in 2002 when our Latina population was very small. I went to college, and I knew I wanted to come back, but I didn't know when that would be. And Voices provided me the space to, one, share everything that I learned in college. I'm a social epidemiologist, and I have a lot of background with quantitative and qualitative research. And I started with Voices just doing a program evaluation, just sharing what I knew, right? And our current former executive director and the way we were developing our resources really provided me the space to see, for me to see that I could do so much more. So I just want to share that I am here in this poll, in this stage, because of the work that we do at Voices. And the work that we do is bringing so much more immigrants to be in that space, just like I am, to be able to thrive, to be able to feel like I belong. And that is me and the work that we do at Voices. I'm really excited to share the space to our next speakers and answer all the questions you all have. Thank you, Alin.
Hi, y'all. I'm Sara White. I am the executive director of the Mental Health Coalition in Teton Valley. So I know that this is really late in the day, but we're gonna play a geography game. Teton Valley means Idaho. Teton County means Wyoming. And so you might be asking yourself, well, why is somebody from Idaho coming up here to talk? Because we're in Wyoming. And that's because my community that I live and work in is a bedroom community for Jackson Hole. I also learned that some folks might not know what that means. So that means 38% of our employees that live over that beautiful mountain that you all have enjoyed watching and seeing while you've been here, drive over it every day to come work here in Jackson Hole. 38% of folks, pretty big number. And a lot of those folks are in the service industry. I don't know if you followed the news, but over the summer, that road literally fell off of the side of the mountain, and commuters had a 3-hour trip to get to and from work. So we're intimately connected, but we also struggle because we're in separate states. And so as a lot of you know, insurance doesn't like to pay across state lines. It's really hard for clinicians to have reciprocity across state lines. And so while Jackson does a great job collaborating, and Teton Valley, which is where? In Idaho. Good job, you guys are listening. We do a great job collaborating with our local providers, our community stakeholders. Oftentimes, it's sometimes hard to collaborate across state lines. So, what we do. The coalition was really conceived in 2009 following a really tragic cluster suicide event that claimed the lives of 19 individuals. Most of those were young adults. And Adam, will you raise your hand, Adam? By our count, he got together with about 4 or 5 other clinicians because they were the only mental health people in the valley at the time, about 5 or 6 clinicians. And he said, what are we gonna do? This is awful. How do we create supports in our community so this does not happen again? And quite frankly, the coalition existed in a file folder that Adam carried around in the back of his car probably until about 5-6 years ago when we hired our first staff member. And then about 3.5 years ago, we got an office, we got a phone line, we got a website, and we started doing more intensive direct services work. Our mission really is to increase mental wellness in Teton Valley, Idaho, by providing advocacy, education, and connection to resources. We do that, our flagship program that Adam helped create back in 2009 because 25% of our residents were not insured or either underinsured, was a community counseling fund. So much like in Vail, we give away 6 free counseling sessions to folks who cannot afford it. We also, like Vail, put licensed clinicians in our schools, and we've done that in a variety of capacities over the years, whether they're seeing individual kids during the school day or whether they're running groups. We help support our schools. We have 1 high school, 1 middle school, 3 elementary schools, 1 upper elementary school, 2 stoplights, no chain stores, lots of farms, lots of skiers, lots of ag. So we're a very rural place. And so access to resources is very hard. So our organization stepping in and filling those gaps is part of what we do. Even though our numbers have significantly grown since it was Adam and 4 of his friends, we now have about 17, 20 providers in our valley. But one of the most significant facts that is a little bit different that I wanted to highlight is that on our side of the mountain, our clinician to resident ratio is about 1 to 1,000. Impossible, right? I was a mental health clinician before stepping into leadership at the coalition. I am overwhelmed by that number. It's impossible for licensed clinicians to serve that many people. So the coalition has tried to think creatively about how do we grow our own support networks? How do we support teachers? How do we educate teachers, community members, coaches? How do we raise the mental health IQ of our community if we know that we're always going to have a lack of trained mental health clinicians? I don't know what exactly the median average cost of a house is in Teton Valley now, but it's gotten very expensive. So much like Vail, we've seen significant rises in housing prices, lots of folks that have turned their rentals into Airbnbs because we have a high tourism industry. So we know that it's going to be really hard to attract mental health clinicians. So part of our focus is how do we strengthen our community members? How do we create peer support networks? How do we think collaboratively about providing services in our county? And then how do we work across the divide so that we can be stronger together? Not surprising that Idaho is not much better than Wyoming and a lot of the stats that y'all have already been presented. And so we really are trying to push really hard in these three areas. How do we do suicide and crisis prevention better? Our closest inpatient treatment facility is about 45 minutes away to an hour and a half away. We have very limited transportation. Like Beverly talked about, still very much a cowboy culture. So how do we decrease stigma, raise the mental health IQ of our community members so that they'll reach out, they'll engage in services? And then how do we think creatively about meeting the gaps in our community? So that's what we're trying to do on that side of the hill, and trying to work more collaboratively with the folks on this side as well. Yeah.
Thanks, Sara. First of all, I want to just thank you all for the incredible, powerful work that you're doing in the community. Thank you. So addressing the needs of the Hispanic immigrant workforce, Kate and Alin, mental health decreases when there's a sense of belonging. So I want to talk specifically about this Hispanic community and how you continue to work together to increase trust and a sense of belonging. That's a really hard thing to do, right? And particularly if we just look at the country in general, how do we continue to create trust? So maybe you can address that question, how you two work together.
Do you want to explain what happened on Friday?
Yeah. If you recall, the bridge metaphor for what we do, outreach is inclusion, is bringing information from immigrant populations to community members. On Friday, we hosted a focus group in Spanish with our organizers, which are the individuals who themselves are immigrants and who are trained in ethical data collection. And we created a focus group that was talking about the dashboard, and it was really centered on this, does this dashboard, would use the dashboard, how can we make this accessible to you? What information is missing? What information is highlighted that you enjoy? And that was something we did collaboratively. I'm not sure how many individuals we had. Stefania, did we have a number of how many attended? 24 Spanish speakers who came in and shared their experience and their thoughts about the dashboard and how we can make it more accessible to them.
And some of the questions that were asked during that focus group session was, do you see yourself in this data? Does this data reflect your experience? And what additional data and information do you want? And recognizing that the purpose of this dashboard is to help us make informed choices in every capacity to improve behavioral health care access. And so really making sure that the information that's there reflects what our community is experiencing. So it was an incredibly powerful experience watching those focus groups happen, and thank you to you and your team. You did a phenomenal job.
You too.
Thanks. And Sara, how about you? You have 38% of your workforce leaving Monday through Friday. How do you create trust and community and a sense of belonging?
It's really hard. I think that's one of the things we struggle with most as an organization. 17% of our population identifies as Hispanic or Latinx. And a lot of those folks are in service industry jobs. They're coming over to Jackson. I think we do a great job at an individual level. So if individuals reach out, connecting those individuals to services in Jackson, there's an organization called 122. Us on our side, we have a similar organization called the Community Resource Center. So we really try to partner with where are those folks going and how do we show up there and build trust at that individual level. And then when we have successes in individual cases, what we find is then they tell their friends, they tell their family members, and then they're more apt to reach out to us. And so we really try to create belonging by going to where they are and not expecting them to come to us. And so we like to have this, like, there's no wrong door. So can we partner with the schools? Can we partner with the construction companies? Can we partner? We just did an outreach event at one of our main building supply companies. And so we're like, how do we reach people by really going where they are and not adding one more thing that they have to do, and collaborating more across, at an individual service level. I think Jackson has done a great job of saying if you live or work, that you can qualify for services and that you don't have to live in Jackson. You can work in Jackson. And so I think that's a real success, but really building from the ground up and it coming from the people.
Yeah, and I would imagine when you're meeting people where they need to be met, they feel seen and heard, right? Yeah. So thank you, great job. So I want to switch a little bit to the behavioral health workforce. And whether you're in Teton County, which has above the national norm of clinicians and mental health providers, or in Teton Valley, which is seeking many, many more, talk about the peer support models that there's been a lot of discussion around that for non-licensed behavioral health professionals.
Yeah, I think that peer support, at least in my experience, a little bit feels like it's a buzzword right now, and it's getting a lot of excitement. And it's not necessarily a new idea, but I think that there's new energy around it. I know Deidre Ashley, who's here representing Mental Health and Recovery Services, has peer support specialists in that organization. And I think here in Jackson that there's an opportunity to expand that model in order to better address the needs that we're seeing in terms of culturally and linguistic representation, and thinking about different demographics that have been historically marginalized. In the survey that we conducted in January and February, asking providers to identify their own sexuality and their own gender, and recognizing that the numbers were so small that they were not statistically significant enough to report in the findings. And so that's not to say that there aren't gender diverse providers here and that there aren't gender diverse individuals. There are, and I would argue that the numbers being so small is that that subpopulation actually needs more support. And so how can we leverage this idea of using peer support that can help meet the clients where they are, the community members where they are, that's a more cost-effective model, creating more providers within our community to also decrease burnout from the clinicians. So I think that there's a lot of energy in this community about that. And one of the drawbacks that I think we continue to face is sustainable funding. It's incredible to think about what has happened in Vail and Eagle Valley, and Paige's comments earlier today are inspiring. And that funding source is not an opportunity we have here in Wyoming. So trying to figure out how can we bridge that financial gap.
Mm-hmm. And Sara?
Yeah, I would say similarly, Idaho faces challenges with funding. Yeah. Certainly, our state has some great peer support programs that you can go through to be certified so that you can bill insurance. There's a criteria that's sort of like a license. Those programs are notoriously behind the times in a lot of ways and not really inclusive. And so one of the things that we've looked at the coalition is how do we create our own evidence-based model to train peer support workers, knowing that the folks that make the best peer support workers are probably already doing a lot of care tasks. They're just not calling it peer support, and they don't have the letters after their last name or the licensure in their pocket, but they're they're doing that work already. And sometimes the way that the training models have been set up are just too unwieldy or too cumbersome for folks to go through. I don't know, like the people that I think about lifting up and helping them get certified in peer support, when I ask them to take a week off of work to do a 40-hour training, they look at me like I have lost my mind. And so even though the state program is fairly affordable to get that training, it's like $700, the time commitment for that training is really difficult. So how do we break it down into bite-sized chunks? How do we elevate the people that are in our churches, that are in our schools, that are coaching our children, that are volunteering at the hospital, and just give them a little extra training, a little extra oversight to just expand what they're probably already naturally doing?
Mm-hmm. So we have some national organizations in the audience, and I'd like to ask each of you, what resources or partnerships would you benefit the most from in order to accelerate both your work and the impact in the community?
Time and money. Does anybody have a lot of time and a lot of money? I'll just say it as an executive, wearing my executive director hat. That's what small nonprofits always need, right? And how do our national folks in the room help support our work? How do they reach out to us? I will admittedly sometimes get frustrated living in a rural space that is isolated by the Tetons on one side and what we call the dry farms on the other, which prohibits sometimes us getting to like other places in Idaho. There's always sort of an expectation that we go to other people, right? Like I come to Jackson, I go to Idaho Falls, I travel. I would love, don't forget about us. Don't forget about coming to rural communities, doing research studies in our communities. So I think somebody mentioned the ease of which you can conduct things in small communities because there's like 4 of us and we'll make time and we probably represent like 20 different agencies in the 4 hats that we wear, and we're probably personal friends with the school superintendent and the principal. And so please don't forget about us. Come do work in our communities. We want you to, we need you to, and reach out to us.
I can attest to that because these 3 up here have been so helpful in building connections for the Ortus Foundation in this local community. So thank you. Alin?
No, I think you pretty much nailed it. Time, money. I think we're immigrant-led, right? And we just did a recent hiring. We work with other immigrants who are leaders and who support us with doing this work. We had 8 applicants, and if we had time and we had money, we could expand over the hill. Not only did we serve Teton County, Teton Valley, Sublette County, Lincoln County, which is like Alpine, Star Valley, Wilson, all these areas. If we had money and if we had time, we would be willing, we would be sending information and ensuring immigrants in those areas can also thrive and feel like they belong.
What surfaces for me is this idea of how can the national organizations share examples of work that can be replicated in this setting, and in a way that's more about co-creation, and that it's not a one-size-fits-all, and that it's not that some large national entity is going to come in and going to know exactly what will work in Teton County, Wyoming, or Teton Valley, Idaho, but really that being a co-creation and collaboration of making sure that the expertise that's local and has lived experience here and understands this ecosystem has a place at the table of how things will be implemented locally, and that there's also an opportunity, I've mentioned this to a couple of people, of this entire symposium has been helpful for me to just pick my head up and be like, oh, right, there are people throughout the nation that are doing this work, and it's really validating to see, and to see that being a mutually beneficial experience.
Thanks. Well, we have a little bit of time left if anybody has any questions for the panel. Anyone? No? Well, great. Thank you so much, Sara, Alin, and Kate, for your insights, and thank you again for all the commitment and time that you put into your communities. It's really incredible. So thank you. Well, here we are. Just really want to thank everybody for being here today, for your commitment, your compassion, your courage to share your work and share your personal stories. Today's conversations focused attention on activities of a variety of professionals working to prevent and remediate the unique mental health needs of the Intermountain states. And this work is hard because you all have chosen to do the hard thing. I want to thank all of the panelists for being up here and all the time spent. I really also want to applaud my dream team, which is the Ortus team. So Marcy, the program director, Karen, our strategic advisor, and Deirdre, who's outside helping with the event. This would not be possible without those three important people as well, so thank you. And last but not least, obviously, the incredible professional technicians at the Arts Center. So Willie, Andrew, Pearson, and Patrick, thank you so much. Many thanks to all of you who have attended and participated. Our big hope going forward is that you stay connected, build connections, and continue to be resources to each other. Your voices and experiences are vital in shaping a future that's more open, more understanding, and way more hopeful. So thank you and have a great evening.